new European guidelines for the treatment of rheumatoid arthritis suggest early co-administration of methotrexate and glucocorticoids or replacing conventional synthetic disease-modifying antirheumatic drugs with rapid tapering and discontinuation of glucocorticoids. Despite the unprecedented advantages of the combination of methotrexate and glucocorticoids in the treatment of rheumatoid arthritis, the use of a cumulative dose of glucocorticoids of more than 1100 mg is associated with a tendency towards high cardiovascular risk. At the same time, reducing and stopping the use of glucocorticoids before reaching this cumulative level eliminates the increased risk of their appointment. In addition, the new guidelines state that Janus kinase inhibitors can now only be recommended to patients without risk factors of cardiovascular disease or malignancy, whose arm is protected. Take care of yourself and be healthy.